Do you feel out of breath even after walking a short distance? Do you feel tired all day despite doing little or no work? Do you experience dizziness, lack of focus, occasional heart palpitations, or notice that your face looks paler than before? If so, don't ignore these signs. These could be symptoms of anemia. Anemia is a condition that gradually weakens the body. Many people suffer from it for years without realizing that their hemoglobin levels are low. As a result, the body's organs do not receive enough oxygen, leading to various complications over time. In today's discussion, we will learn what anemia is, why it happens, how to recognize it, what tests are needed, which foods help improve it, what mistakes can worsen it, and how to prevent it. What is anemia? Our blood contains red blood cells which carry a special protein called hemoglobin. Its main function is to transport oxygen from the lungs to every cell of the body. When the body does not produce enough hemoglobin, or when the number of red blood cells decreases, it is called anemia. So, anemia is not just low blood, but a reduced ability of the body to carry oxygen. Why is anemia called a silent killer? Unlike many diseases that show sudden symptoms, anemia develops slowly. In the beginning, it may only cause mild weakness, which is often ignored. But over time, it can affect the heart, brain, kidneys, muscles, and immune system. Many people think I'm just tired from work, but in reality, long-term anemia could be the underlying cause. Common symptoms of anemia. Symptoms can vary from person to person, but common signs include constant fatigue, shortness of breath with mild activity, breathlessness while climbing stairs, heart palpitations, dizziness, cold hands and feet, pale face, lips or under the eyes, poor concentration and memory, lack of interest in daily activities, hair fall and brittle nails. Some people may not have any noticeable symptoms at all. That's why regular health checkups are important. An unusual symptom of iron deficiency. Some people develop a craving to eat non-food items like soil, raw rice, chalk, or ice. This condition is called pica and can be a sign of iron deficiency. Causes of anemia. 1. Iron deficiency. This is the most common cause. Without enough iron, the body cannot produce adequate hemoglobin. 2. Vitamin B12 and folic acid deficiency. These nutrients are essential for blood formation. A lack of them can lead to anemia. 3. Excessive blood loss. Heavy menstrual bleeding, piles, hemorrhoids, stomach ulcers, intestinal bleeding, blood loss after surgery. These can gradually deplete the body's iron stores. 4. Chronic diseases. Conditions like kidney disease, infections, inflammatory disorders, or cancer can also cause anemia. 5. Genetic causes. Inherited conditions like thalassemia can cause red blood cells to break down faster, leading to anemia from a young age. Who is at higher risk? Adolescent girls, women of reproductive age, pregnant women, breastfeeding mothers, elderly individuals, malnourished people, vegetarians lacking balanced nutrition, people with chronic blood loss. How is anemia diagnosed? Symptoms alone are not enough to confirm anemia. The most important test is a complete blood count (CBC). Doctors may also recommend tests like serum ferritin, iron studies, vitamin B12 and folic acid levels if needed. Avoid taking iron supplements on your own, as not all anemia is caused by iron deficiency. Foods that help improve blood levels. Green leafy vegetables. Spinach, red amaranth, water spinach and other leafy greens are rich in iron. Lentils and pulses. Lentils, chickpeas, mung beans and other legumes provide iron and plant-based protein. Traditional foods. Foods like taro, colocasia, banana stem and banana flour are nutritious and beneficial. Fish, meat and eggs. Iron from animal sources is more easily absorbed by the body. Nuts and seeds. Sesame seeds, pumpkin seeds, peanuts and dried fruits contain iron. Vitamin C rich foods. Lemon, orange, amla, gooseberry, tomatoes and guava help improve iron absorption. Consuming them with iron-rich foods increases benefits. Does eating pomegranate alone increase hemoglobin? Many people believe that eating pomegranate daily can cure anemia. In reality, it's not that simple. While pomegranate is healthy, it is not a treatment for anemia. Similarly, dates contain some iron, but they cannot cure moderate to severe anemia alone. A proper diet along with medical treatment if needed is essential. Habits that can worsen anemia: excessive junk food, irregular eating habits, alcohol abuse, smoking, long-term use of antacids without medical advice, poor nutrition. Why extra care is needed during pregnancy? During pregnancy, the body needs more blood for both the mother and the baby. This increases the demand for iron. If iron intake is insufficient, it can lead to weakness in the mother, complications during delivery, and developmental issues in the baby. That's why pregnant and breastfeeding women should take iron and folic acid supplements as advised by a doctor. What happens if anemia is ignored? If left untreated, the heart has to work harder, long-term heart function may decline, energy levels drop significantly, work and study performance suffer, immunity weakens, pregnancy complications increase, children's physical and mental development may be affected. How to prevent anemia? Eat a balanced diet daily, include vegetables, fruits, lentils and protein-rich foods, add vitamin C to your meals, avoid excessive junk food, do not take medications unnecessarily, seek medical help for heavy bleeding, get regular blood tests if needed, pay special attention to children, women and elderly nutrition. Anemia is not a minor issue. It is a condition that can gradually affect every organ in the body. The good news is that in most cases it can be managed effectively through proper diagnosis, a healthy diet, appropriate treatment and regular monitoring. So don't ignore unexplained fatigue, weakness or dizziness. Get tested on time, consult a doctor and maintain a nutritious diet. Stay aware, stay healthy.